Is your receptionist helping or hurting your practice? That's what I want to talk about in this week's tip. Reception is a very important position and is often not treated that way, and this needs to change. They are the first point of contact for any existing patient or any new call that comes into the office. But let's look at what I hear from many docs as to what they're doing in their offices. What do they normally do? Answer a phone call, possibly make some appointments, greet patients, insurance eligibility checks, they answer some questions for a new patient or an existing patient, and the list goes on and on. But are all these real functions of a receptionist? In our office, reception is the first point of contact. Her primary job is to help them. When I say help them, it is their job to pass on the communication that they received from the patient to the right source in the office. Maybe it was a call for the scheduler to make an appointment. This is their primary job. They should also follow policy. I have 2 standard policies. Answer the phone in the first ring, transfer the phone call and or the communication that they received to the right party. I use management tools to ensure that they are doing this properly. Now, how do I know if they're doing this right? We use what we call as a call log sheet. You can click the link below in the description. I can download this for free. The call log sheet has the date, name, phone, reason for the patient calling, made appointment, yes or no, and all incoming calls are recorded, both existing and new. What do I get out of this, you may ask? I want to know how many phone calls came in that week, how many of them were new reaches, and how many of them converted to patients. What do you think I will do with all this information? I can now verify the marketing I'm doing, is it working or is it not working? Or do I need to change something? I can understand what patients are calling for. Is it for scheduling for a procedure appointment, or is it for a hygiene appointment, or is it an emergency? I can definitely predict if my receptionist is actually doing a job or not. It also helps me identify where all my income is coming from. Are they coming from new patients? Are they coming from existing patients? All this from a simple single call log sheet. What do you think? Can you implement this on Monday morning? Absolutely yes. I don't want you to think I'm magically brilliant and figured all this out myself. No, I actually didn't. I learned all this from MGE New Patient Workshop. If you want to know more information, you should definitely look them up. Go to newpatients.net and get any information you need. If you like this video, please hit subscribe, and I hope to give you more tips in the near future. Until next time, ciao.